Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the CEO and co-founder of HealthSnap. Samson, how are you today?
Doing great, Jared. Thanks for having me.
I'm excited. Let's dive right in. Tell the audience a little bit about yourself, and then we'll dive into HealthSnap.
Yeah, absolutely. My name is Samson. I'm the co-founder and CEO of HealthSnap. We help healthcare providers remotely monitor and manage patients with high risk, high cost chronic conditions in the home through a combination of remote patient monitoring and chronic care management.
So Samson, first question I always ask people, what made you want to start this company in the first place?
Absolutely. You kind of have to be a little bit of a masochist, I think, to start a company in general, and it's a long slog. So you have to go all in to do this the right way. For me personally, I was pre-med. My lifelong dream was to go into medicine, so I was pre-med. I loved nutrition, science, helping people, and so that became a really big passion of mine. As an undergraduate, unfortunately, my grandfather's health started deteriorating. He had multiple chronic conditions his entire life. He had a heart attack in his 40s. He was diagnosed with type 2 diabetes in his 60s, another heart attack in his 70s. Because of his type 2 diabetes, lack of management, he unfortunately lost a limb. His story was obviously very painful for me and my family. And he ultimately passed away and became my inspiration for trying to change this status quo in how chronic conditions are managed. But his story is not unique, right? Like I talked to so many people that can relate to why we started HealthSnap, and they have a family member or a friend or someone they know that had a very similar experience. And so our current healthcare delivery paradigm is just completely backwards when it comes to managing chronic conditions. There's so much capital being thrown into this market, but we felt like we needed to reinvent the way they're managed at the point of care, which is with healthcare providers and health systems. And that became really the inspiration for starting the business back in 2015. And we've been building ever since.
And I guess, what were some of the early challenges that you faced when you were first kicking this off, and how did you get past those?
Yeah, absolutely. I mean, the early years were definitely, a lot of learnings and slow goings, right? Before 2019, there was not even reimbursement for remote patient monitoring. So when we launched the solution, we weren't even calling ourselves an RPM platform. We were focused more on chronic disease management, care plan management, lifestyle and behavioral change programs. And we would try to sell to self-insured employers or concierge medicine or, practices that were more innovative and trying to use this as a revenue generator, but there wasn't a real traditional healthcare delivery model for us because there wasn't payment parity around it. So we had to figure out creative ways to, get to market. And it was very slow goings in the first couple of years. I mean, we really took it year by year and just tried to build the best solution for the best patient experience and the one that was the most evidence based. And in 2019, when the reimbursement changed, the landscape changed, and then COVID the year after, we had all the foundational pieces in place. And then, we had a tailwind that we could not have expected that completely accelerated our business to levels that we're, grateful for every day now and super thrilled for what the future holds.
Now, you've been running this company for you started off in the chief business development, right? Like that's
Yep.
your focus was business development. So I would like to hear how your business development approach has changed maybe since the start, or have you stuck with the same approach? So this is two parts, and then the other part is kind of as you're talking about that. This company's been around for not quite 10 years, but almost 10 years. That in itself is a major, major accomplishment. So let's maybe do that one first, and then let's talk about the business development piece. But, what do you attribute that to? Because that does not happen. Companies are it does not, it is so rare nowadays to see a company operating for almost 10 years.
Yeah. Well, first of all, I'm glad you asked that, right? Like, not to get too much into the economics of it all, but right when you're in a ZERP environment and there's so much capital being raised, you have these peaks and valleys. We never took on insane amounts. We didn't raise $100 million Series A with no revenue. We were very thoughtful in our approach and took the long approach to the long thinking approach to everything that we did from the beginning. And it starts and ends with the patient experience. So for us, we were very sustainable. We bootstrapped our first several years. Over time, we just had the discipline and the grit to never give up, despite, having areas, times in the business where you were cash strapped and global pandemic that, made fundraising and business building virtually impossible for everyone. But I think for us, we stuck together. We had, I'll attribute that to my co-founders that have been. I couldn't ask for better partners, and we've built an amazing team around us that believes in our mission and vision, that uses that during the challenging days, and we just take it one day at a time, and have gritted our way through building a really successful healthcare technology company.
And what do you like? So let's talk about that a little bit. Not to call out VCs or anything like that, right? But you kind
Sure.
of talked about the magic formula a bit in terms of so many companies these days look at like around pandemic levels. They took on massive amounts of capital that you could almost like from an outsider, right? You could see, and they're never going to be able to, you hope they do, but they're never going to be able to take that capital and, you know, like now the expectations went up tenfold, right? When they take that amount of money. And also, I said this, we had a competitor that raised like everyone else was raising probably like 10, 15 million. They ended up raising like 80 million. And it's like sometimes head scratching, right? When you see some companies, it's like, sure, you could spend it, but what, like, how do you spend that on like solid growth? So I guess kind of going back to your business development structure, right? Like, I'm a big fan of bootstrapping for as long as you can, and I think it's becoming more fashionable again. But like, do you agree that you learn just so much more about like how to grow a business when you are bootstrapping? Because that's what I always found was when I'm bootstrapping something, you have no choice but to do it kind of the lean way and then make decisions really quickly.
Uh, so absolutely. You also get a firsthand feel for the impact of making missteps when it's your own capital or you are bootstrapped. And so you end up becoming very, frugal. And that mindset doesn't change even as you scale. Like we just raised our Series B. My mentality has not changed around being a steward of capital, whether it's a venture capital firm or my own. But I'm going to make pretend that that's my bank, and money coming in needs to be more than the money going out. And I don't think a lot of founders truly appreciate that versus like, oh, I raise VC and I can do whatever I want now. But it's a really strong, it's a fiduciary responsibility, and you have to take ownership of that. It's your job as the CEO ultimately, to be a steward of capital and to ensure that your people are stewards of capital, more importantly. And yeah, we've just always stuck to that mentality, and I do attribute that to why we're still here almost 10 years later.
I mean, that's a applause for your team, you and your team too, because that is not a that is not a mindset at every company, right? You see, I just watched the Super Pumped
Oh yeah,
series with Uber, right? They did
great
not
show.
worry about that investor money. That was like fun money, right?
Yep.
Millions of dollars on parties and all this other stuff. Now it worked out for them, but I also think there were certain companies that succeeded years ago when it was just they'll just keep getting the checks from investors. They would not succeed today in this climate because they wouldn't get that follow-on capital.
Absolutely. I think a lot of founders are learning the hard way that you can't assume there's going to be a next round, and you can't assume that the multiples of where you think you should be raising at are going to be there, because that's not the reality of the environment that we're working in right now. So, this last round I think was the eye-opening experience for me personally to go through that and get a significant Series B over the finish line. But I do think a lot of founders are going to be in a tough spot when they raise a very frothy Series A or seed round and now have to live with the fact that they're going to have to probably do a down round or get creative with their next use of capital.
Yeah, it'll be interesting to see how some because we're probably getting towards the end of a lot of companies that raised a lot of capital during the pandemic. With that 24, even sometimes 36-month runway, and they're either doing it quietly, right, where they raised and we don't know about it, or we'll see what ends up happening. When you look at going back to the company, how are you? I guess what are some of your predictions for the future of healthcare, particularly in managing chronic illnesses? And I guess how do you at HealthSnap how do you prepare for those future trends?
Yeah, look, I think it starts with what's our current model and where does it need to get to, and where do the incentives align to help, create that acceleration into a new model. Despite all advances in all the capital, right, our healthcare delivery model is still reactive, it's still episodic, and it's still delivered in a bricks and mortar clinic. even post COVID right now. And ultimately, that leads to treatment as opposed to prevention. For us, our vision and the way we've always thought about it is, especially with chronic conditions that happen over long periods of time, you need to be delivering proactive care that's personalized, that happens in the context of daily life. And right now, there's gaps in care the second a patient leaves the office, and 6 months later, you just got wildly different changes and trends in their data. So our model is designed to say, well, what if we delivered always on healthcare, and that we could monitor people between office visits in the context of their daily life? It wasn't disruptive, and that if they needed the care where they were and when they needed it, they would have access to someone to be able to help them. And that's what we do every single day. We work with over 70,000 patients in 33 states right now, and improving access to care when they need it is the ultimate way to drive a proactive care delivery model that's focused on prevention and not treatment of these conditions.
What do you think still needs to change? I mean, there's a lot, right, in healthcare that needs to change. But if you had to
Yep.
single kind of that focus down to one thing, what's one thing you would really like to see changed soon in healthcare?
Yeah. So I'll say this because it's my background. I have a master's degree in nutrition and exercise science. And, if you think about all the major chronic conditions, they are diseases of lifestyle. Doctors in the US are not trained on nutrition science or exercise science or behavioral change. And so when people have these chronic conditions or trying to get help, it's a medication. Here's a prescription for blood pressure medication, or, metformin for your diet, whatever it is. And so what I would love to see incorporated is more therapeutic lifestyle intervention, behavioral change programs into traditional healthcare delivery. Remote patient monitoring and chronic care management give us the space to incorporate that into our care plan models and delivery. It's why we're driving meaningful patient outcomes. But traditional healthcare and the way that we're training physicians is still in a 20th century care delivery modality where big pharma is saying, hey, just prescribe medication for these treatment protocols, when these are conditions that happen over long periods of time and need to be treated over long periods of time, not acutely with medicine.
What's frustrating, yeah, I'm with you. What frustrates me is like, it's to your point too. You go to the doctor. Let's say someone has gained some weight. The doctor immediately, like, they'll whatever they'll do. Now they'll put you on, potentially they'll put you on Ozempic or something like that,
Yeah.
right? But what if, like, I don't think we also dig down enough, and I think you're starting to see this with like the Nooms of this world and those type of companies, in the behavior change as well, right? Okay, someone gained weight. They don't really dig into, why did you gain weight? Is work stressed? Are do you like to, first off, do you like to cook? Because if you don't like to cook, or you're not going to cook, how do you create healthy meals? And then where is that referral to the meal prep? I've used all the meal prep services, by the way. There's very few that are actually, you get sick of them in about a week, and they seem like they're very high in preservatives still, which you don't want. But like, I would love to have that plan where you go to the doctor, they put you on an exercise plan, they give you certain foods to eat, and it's all seamless. So that anyone listening, if I know there's companies that are trying to do this, do it faster, please. But yeah.
I'm with you. And you touched on it a little bit, but there's a lot of psychology behind behavioral change. Something that we do when we work with all of our patients in our care management programs, is we actually incorporate what's called the trans theoretical model of behavioral change. If I ask you right now, like, hey, on these different buckets, are you even thinking about making changes? Have you thought about changes for your exercise and nutrition? Have you recently started making small changes? Do you have a routine built already and you're trying to now maintain that routine? Where do you fit on that spectrum? And the way that you educate someone and work with them on that behavioral change relative to where they are in that stage is vastly different. So you're not going to take someone that's sedentary and obese and hasn't walked more than a mile in the last 3 years and say, hey, all of a sudden we're going to put you on a running program. Maybe it's just like adding 3 blueberries to your cereal in the morning. Like, they're very different approaches to the way that you intervene and help people.
Yeah, it, we had the founder of Noom come on. He said one of the reasons people also like get out of a diet or a workout program is because they try to do the 360 overnight instead of making those moderate changes in their lifestyle, and then either get overwhelmed or burnt out, and then they go back. And then I also heard something the other day when people always say, "I've been on a diet for 10 days now." And they'll say, "Why are you counting?" You're counting because when you decide to stop, well, I made it 14 days on this diet, right? Just it has to be a lifestyle. But yeah, you're right. This could be a 3-hour episode, right? If we talked about,
We could unpack all the nutrition science for a day if you want to.
I say let's do it. Let's get a group together and let's think about that. We'll connect on that separately, Samson. But as we wrap up here, what's next for HealthSnap that really excites you that you can share with us here today?
Yeah, look, ultimately, we're really proud of the results that we've been driving with health systems around the country. We've brought on 6 different health systems in the last 12 months that are, and I use the phrasing intentionally because a lot of systems have done this over the last several years. They've started these programs, but they haven't quite gotten to real scale and real impact. Our partners have scaled these partnerships, these remote patient monitoring and chronic care management solution with HealthSnap to full statewide deployments for 400 plus primary care providers. And so we're really proud of our ability to drive meaningful impact in regions of the country. And we're continuing to bring on more health systems that are driving those meaningful outcomes and engagement for their populations. And something that we've been starting to do recently, and we can share more and be continuing to share publicly, is our outcomes data and publishing outcomes data in journals like eHealth and telemedicine, because there really isn't much clinical efficacy in RPM and CCM, despite the fact that it's been around for 6 years, 5 years for RPM, and almost a decade for CCM. And we're leading the way with our partners and co-authoring publications with them to demonstrate long-term sustainability of these programs as CMS evaluates them over time. Because despite there being reimbursement, that's a function of driving meaningful patient outcomes, decreasing utilization, and lowering total cost of care. And we're at the forefront of driving that change and demonstrating that these programs do work and they work at scale.
Well, I'm excited to stay in touch with you and continue to follow that progress. And congrats on all you've done so far. And um, we'll definitely have to have you on soon, especially. Well, this is farther out. We'll have you on before then, but definitely if at that 10-year mark would be really cool for like a cool 10-year anniversary episode too. But thanks so much, Samson, for joining me on the podcast here today, and excited to continue the conversation in the future.
Likewise, Jared. Appreciate it.